opportunity in personalized medicine for better health and outcomes. Next. The economic burden of healthcare is increasing, and in light of that, the economic burden to our target patient population of organ transplant and immunocompromise is the costs are growing regularly. And currently, there are no proactive and predictive approaches to assess the potential occurrence of rejection and infections. So we focus on two main threats to the organ transplant and immunocompromised population. Number one is rejection, and the second one is infection. So 50% of the transplant organs are lost in 12 to 17 years. Organ failure results in immunosuppression, and immunosuppression results in rejection, infection, cancers, and more. So we're looking at a large and growing market here in the US of over almost 10 billions, and the global market is almost 3 times larger than that. So every year in the United States, there are 43,000 new organ transplants, and currently there are another 400,000 patients, immunocompromised patients, that have had organ transplants before, and our tests are addressing the testing needs before the transplant and after the transplant. Next. So Plexision markets overnight cell-based blood tests to predict transplant, rejection, and infection in immunocompromised patients. And our tests are accurate. They cost half as much as the rest of the tests in the market. They are, the results and turnaround time is half the time of the rest of the tests in the market, and they're reimbursable to the hospitals, and they're backed by 24 patents. We're already serving large organ transplant organizations, and we have a proven suite of tests that are used by current clients and a large pipeline of clients. Next. So we have a complete suite of rejection infection tests, and we have the first FDA approved rejection test, and we have 2 CMS approved tests. And we have a Plexision lab that has got all the regulatory approval, not only to offer tests, but also to manufacture test kits. Next. So currently in the market, there are 2 types of tests. There are the cell-based tests that Plexision offers, and there are the cell-free DNA and RNA tests that are offered by the rest of the competition. And out of the rest of the competition, they offer the rejection test, but only one of them offers the infection test. So we are the only company in the market that has a complete suite of both rejection and infection tests. And you're going to ask, well, why now? Well, we have the solution that fits the market needs, and it is proven effective. We currently have tested 6% of the pediatric kidney transplant population, and we are ready to expand that to the adult population. And there is an increased demand for organ transplant due to COVID. There was a backup. As well as there is an increased interest in predictive approaches to optimize transplant management. So some of our advantages are that as of 2023, CMS guidance is restricting the use of gene-based tests in the market. We have a differentiated cell-based technology as a common platform for all our tests, which permits timely decision-making at affordable cost, as well as predictive with potential, predictive with a potential to extending the life of organ transplant patients. Next. So we have an experienced scientific team with more than 100 years of experience, led by Rakesh Sindhi, and an operation team with another 100 years of experience, led by CEO Rajiv Sindhi. So next. We're expecting to reach $80 million by 2029, and we are revenue breaking even. We're all self-funded. Our 2023 revenues were 33% higher than the 2022, and main revenue streams are large transplant centers and the research contracts with pharma making anti-rejection drugs. Next. We are seeking $3 million for the first year and $7 million for the second year, and that money is going to be going towards team building, marketing, laboratory automation and equipment, and growing the scale of our manufacturing facility. And we invite you to join us towards the journey of personalized medicine for better health and outcomes. Come and talk to me outside.